everybody. Yeah, I'm checking in for Vlogmas. I missed the last couple days. We had some incidences going on, and I have a house guest staying with me for a few days, so you might hear some extraneous sounds in the back. That's just my little friend Snowy. And Meows is hiding back here. There he is. Meows is not sure if he likes having Snowy around or not. Snowy's a dog, by the way. Meows thinks he's a dog. But anyway, had a wonderful visit with Dr. Hidari today. Tomorrow is my 1-year Surgaversary. And I'm getting very emotional. Is how far I've come. This is me now. This was me then. Look at that face. I think that pretty much sums it all up. This me, in pain, upset, stuck in a bad marriage, feeling somewhat trapped, just lost my sister. Yeah, there's lots of emotions, lots of anxiety, lots of anguish, and lots of mourning. And now me, I feel like I'm full of life. I feel like, I've been in remission for over a year now from the psoriatic arthritis. I am happy about life, ecstatic about life actually, and life is really good right now. Life wasn't so good in that picture. I went to the doctor's office today for my 1-year checkup, and I'm 1 day short of a year. Tomorrow's my Surgaversary, but I went in thinking, you know, I've come so far, but I'm not at the goal that he set for me last time. And I've been at a plateau now for going on 3 months, and it just, fluctuates a minimal amount. And so I'm like, maybe this is the weight that my body wants to be. Maybe this is where it feels the most comfortable. I'm happy with myself. I'm happy with my size. I'm happy with how I look. One of the things Susie pointed out to me in this picture, when Susie, the nurse, when she brought me the picture, she goes, "You look 20 years younger." And I actually keep thinking I look older because of this thing here, But she's right. I do look younger. And I think that a lot of that has to do with my outlook on life and how that's changed and how I'm taking life by the balls. Please forgive the phrase, but it's kind of become my motto is I want to grab a hold of life and hold on and do what I want to do in my life, Set those goals, hit those goals. I wish I would have done this earlier in my life, but everything comes with timing. And I think this was the time for me to make that change. I talked to the doctor today about plastic surgery. Yes, that thing I keep bringing up. And I kind of got a little bit of rough news. They want you to maintain your weight for 6 months. The insurance companies do. However, I've already been maintaining my weight. So I am going back in 3 months, since I've already maintained for 3 months. And hopefully I'll get the okay to go find out about plastic surgery. And if everything goes according to plan, the end of May, middle to end of May, somewhere in there, I will hopefully be having the first surgery, which will be on my stomach, to remove the excess skin around my stomach, and the doc agreed that that needs to go. When I get to my measurements, you'll understand why. The arms and the breasts don't take as long to recover from. So if I can only do one this summer, I'll do the stomach, because that one will give me more time to recover. The arms and the breasts don't take as long. And my concern is because of my having to go off of my medication for whenever I have surgery, I have to go off of my immunosuppressant medications. So I'm curious. I'm thinking that may hinder my recovery, or it could make it faster since I have an overactive immune system. But because of that, I kind of try to plan for more time to recover. And so I'd originally wanted to do this mid-April, have the stomach one, and then mid-May have the arm and the breast one done. And then I'd have the rest of the summer to fully recuperate. It doesn't quite look like that's going to happen. It looks like the stomach's going to probably be first, and that will probably be June, early June. I don't really know yet. I'll know more in March when I can make those appointments and do all that good stuff. You know, I'm excited about it. I want it to happen, and now the thought of having another surgery is kind of scary because, you know, my stomach surgery was actually my very first true surgery ever. I had like tooth surgery, but I don't really count that because tooth extraction is way different than having your stomach cut out, you know. I still have my appendix, still have my adenoids, still have my tonsils, all that stuff. Never had those removed. So it was pretty scary for me, that first surgery, because I never knew, I'd never been in the hospital for more than a day before. And I've lived with chronic pain, so I know what it's like to have pain. But I also know that my pain tolerance level is really high. And that's not always a good thing, because you don't know when something is really bad for you. It's really hurting you. So I learned that way. Anyway, today's, because of the check-in, today's thing is a little bit longer than it would normally be. Here are my measurements. This blew my freaking mind. My neck. And the before picture, look at my neck. It looks like my head is a giant toe. It just comes out of my body. There's no difference between my neck and my head. My neck at the time was 20 inches around. It is now 15 and a half. I can wear normal necklaces again. That was something that never occurred to me that would be possible for me to do. My chest deal area, I went from 65 inches to 45 inches. 20 inches off my boobs. My waist went from 62.5 to 42 inches. So 20.5 inches off my waist. And then my hips, my hips went from 67.5 to 52.5. So it's only a difference of 15 inches, which is a huge difference. Don't get me wrong. It's just that number would be better if it wasn't for the extra skin. My apron down there, I think that when that comes off, I'm going to have like 4 to 6 inches probably taken off of this. Sometimes I will sit in front of the mirror. I'll just take my skin and move it around to see, like what I'll look like when it's gone. And I am currently in, these are size 16 pants I'm in right now. I think I would probably be in a 12, well, at least a 14, probably more like a 12 or a 10 without my stomach. Yeah. I'm still in a large and extra large, but that's mainly because, in the tops, I should say, because of my breasts. One of the things that I'm looking into with the plastic surgery is a possible reduction, because I have had back issues before. I did physical therapy for a year for my lower back, and I think that, yeah, these probably have something to do with it. So we're going to check into that and see if the insurance would pay for a slight reduction. I don't want to go too much smaller because I like my breasts. They're what gives me my curvy figure. And now I don't want to be totally flat. I don't want to be model thin. I want to be me. I want to keep my shape, just make it smaller. Does that make sense? Yeah. Anyway, right now it's hard for me to get bras. especially now. This is what's weird. It's harder for me to get bras now than it was when I was bigger. When I was bigger, I could get bras from like Catherine's, and places like that. They specialize in larger sizes. Well, now my band size is normal, but my cup size is bigger. So now I can't buy them locally. Yeah, people keep telling me Victoria's Secrets. I have 2 Victoria's Secrets bras, and they just barely fit. And I have to watch what I wear with them, because they'll show a little too much if it's too tight. And so, I mean, even the sizes that they carry aren't truly my size. I'm actually a cup larger, because one side, well, it fits one size, but not one side, but not the other side, if you know what I mean. So I'm thinking if I'm able to do a reduction instead of the lift, because if I pay for it, it's just going to be a lift. If the insurance pays for it, I'm going to try for a reduction. I'll be able to buy in normal stores, and they'll be a little lifted, a little perkier. But anyway, that's my dilemma right now. My arms, I'm working out. They're still very, very flabby. All of this here, so 2 inches, 2.5 inches, is all extra skin. My arm would look like this without the extra skin. So my arms, I'm pretty sure, are ready. I don't think there's any fat left in there. There is some fat left in my apron, but they will still do that surgery. They prefer that there wasn't as much in there, I'm sure. But hopefully by April I'll be down a little bit more, because Doc says this first year is super important, and for some people who only have 50 to 70 pounds to lose, if they don't lose it by the end of the first year, they're not going to lose it. But in my case, because I had so much, he thinks I can still keep going through the 18 months, that I can still continue to lose weight. And so, even though my body is kind of telling me it's happy at this weight, I might still lose more. Because I would actually, honestly, I would like to lose another probably 40 pounds. 40 to 60 pounds. But part of that would be the skin removal, because that does weigh up. That extra skin, especially on the apron, is quite a bit. I would say probably around 20 pounds, because I do have quite a bit of it there. And I'm not expecting them to take any off my butt or any of that. It just reconfigures that. But I'm going to go ahead and sign off for now, because I got a little coffee spell happening. So have a wonderful day, and Merry Vlogmas. Forgot to mention one thing. My scales broke. Remember how I said my scales broke? So apparently I wasn't down as much as I had thought I was, because at one point my scales told me I was at 199. I am not in Wonderland yet. The scales at the doctor's office said 219 fully clothed. And so my 195 that I thought I lost, it's actually 175. But I'm not going to beat myself up about it, because that's still 175 pounds. That's a whole nother person. And so I'm still doing fine. I'm doing okay. And I've still been successful. I mean, I hit the goal that Doc wanted me to hit, which I didn't realize that at the time. So I'm well on my way, and I'm still a work in progress, and I'm going to keep working. If all goes well and I can afford it, I'm going to inquire about getting this done too. I, thought that I was getting it better. I don't know, maybe I just need more time. But I'm going to, that'll be the last thing that I'll get done. But life is good.